Hello there, this is a message going to Nick Clegg, the MP for Sheffield Hallam. I'm not expecting you to remember this, but my name is James Bond. I'm one of your constituents. Again, I wouldn't expect you to remember this, but I'm a medical doctor turned personal fitness trainer. And the fact that you've opened up this video tells me that you've read the first few lines of my email about Carl Thompson. Now, I have copied this to the members of the press who actually ran a story on this gentleman. And what I'm suggesting to you is that to help this gentleman, who I'll tell you about in a minute, if he can be brought to Sheffield where I can rehabilitate him, I have access to, well, subject to the manager's permission, a gym in Sheffield which will be great for him. I have access to a nursing qualified weight loss hypnotherapist, and we can easily get access to a GP and hopefully a dietitian. Okay, so that's my call to action. Okay, that's what I'm looking to do. If funding can be arranged for him to be transferred to Sheffield, that would be great. Okay, now I was very saddened to read his story, although I was very pleased to see that he's been inundated with offers for help. That tells me there's some humanity left in this world. However, and this is the big problem, with the greatest respect to those people who offered him help, they will not help him, and I'll tell you why. This man cannot go to a gym. He can't. It's not as easy as eat less and exercise more. If he doesn't eat enough of the right kind of food, he'll go into a deadly medical condition known as ketosis, and his relationship with food is basically gone to pot. He does need a specialist weight loss hypnotherapist. The one I have access to has 35 years experience as a nurse, so she knows what she's talking about. Anyway, that's a different story. This man cannot go to a gym. I'll explain why. First, imagine this. Imagine you're at an airport and you've got two plastic carrier bags. No problem. Imagine those plastic carrier bags, not carrier bags, but they're suitcases, each weighing 200 kilograms each. Now can you see how it's going to be difficult? Okay. He can't go to a gym. Firstly, how is he going to get there? Most cars can't accommodate a weight of 400 kilograms, which is what he is. Okay, then how is he going to get in? Most gyms don't have a wide enough door. Some have turnstile access, so which gets stuck. Okay, guys like the gym floor, women like classes. So if he likes the gym floor, he could get stuck in the fixed resistance machines. He might be too heavy for some of the for the cardiovascular equipment. Where is he going to get changed? Okay, without embarrassment. He clearly will need some help with getting changed. Okay. If the gym has a pool, how is he going to get out? How is he going to get in? How is he going to get out? If he drowns, are the lifeguards going to be able to help him? No. Okay. For women, they're like classes. So if it's an overweight woman going to stand at the front and be embarrassed, or stand at the back and miss out, I can tell you I've had to exclude able-bodied people from my fitness classes for making fun of the obese. Sad as I much to say. Okay. Most importantly, a gym program for someone like him needs to be devised by a properly trained fitness instructor, of which there are very few. When I worked at one gym, one of my colleagues who only had 2 weekends of training said, worked out a program for such a gentleman. It's a good thing I was asked to review it. It would have killed him. Okay, so that's the problem. Now, let's take it one step further. Surgery for this gentleman is going to be a nightmare. Okay, consider this. He's got to be transported to hospital. Okay, what's then going to happen? He's on a hospital bed. Most hospital beds can't accommodate 400 kilograms, so there's going to be 2 porters to transport him to theatre. It gets worse. Getting an airway in him will be very difficult. The breathing apparatus will have to work overtime. Maintaining his circulation will be a nightmare. Getting intravenous access on this man will be very, very difficult indeed. Okay. The operation itself carries a 2% risk of death. In his case, it could be a lot higher than that. There's risk of sepsis, that's a widespread infection, a hemorrhage, massive bleeding, especially from the liver, a heart attack, infection, peritonitis, that's an infection of the lining of the gut, hepatitis, and perforation of the organs. Okay, it's a very, very risky procedure. It carries a 2% risk of death. On top of that, what about post-operative recovery? It's going to be a nightmare keeping this man in a high dependency unit. He'll have to have a nurse with him at all times. Okay. There are inherent risks of weight loss surgery. First of all, the risk I've just told you about. You will end up with loose skin. There's no question about that, because the metabolic rate of these people is enormous. And if you do a gastric bypass, what then happens is they're not absorbing as much, and therefore what happens is they have a lot of loose skin because the fat is depleted very quickly. It may not work. Okay, it's not guaranteed to work. It can go too far. You could end up so weak that you're on walking sticks. It's irreversible, so there's no going back once you've had it. Okay, and on top of that, you will end up with a tremendous amount of loose skin, so they will need further surgery. On the program I propose, yes, he will have loose skin. Okay, the weight loss, or the fat loss, is not so rapid, but what will happen is it's irreversible, so he can stop at any time. Okay, and on top of that, it doesn't go too far, because again, we can stop it at any time. On a massive muscle building program and cardiovascular fitness, as the time progresses, then we can greatly improve this man's quality of life, and hopefully in time get him leading a normal life again. That's what I propose. Now, there's got to be a funding problem here, okay? But it's a damn sight cheaper and better value under what I propose, as opposed to surgery. I don't have a problem with the weight loss surgeons are a very decent bunch of people. I don't want anyone to see them in a clinical setting. Social setting in the pub, absolutely fine, apart from the fact that the weight loss surgeons tell some awful jokes. You see them in the pub, great. Great to see them in a social setting. In the clinical setting, I don't want you to see them. And the other thing is, in the time it takes you to do a gastric bypass, they can do 5 hernia repairs or something like that. So what I was going to suggest is, subject to the patient's agreement, perhaps you might want to liaise with the authorities in Kent, bring him up to Sheffield, and let's see what we can do to rehabilitate this gentleman. My name's Bond, James Bond, leaving you shaken but not stirred. My telephone number is on the email I sent you. I'm more than happy to have a chat or come and see you. Have a nice day, Mr. Clegg. Bye bye.